An initiative to bring high-speed internet to all First Nations in BC is resulting in cutting-edge healthcare for some communities. Pathways to Technology, a project managed by All Nations Trust Company, is enabling Carrier Sakani Family Services to provide telehealth care to 11 member First Nations over 76,000 square miles in north-central BC. Telehealth is good for patients, healthcare professionals, and our healthcare system.
We're seeing more patients, the outcomes are better, we've reduced the cost of travel and also just the wear and tear on our staff of having to be out on the road as often.
Community health nurse Katie O'Shea splits her time between Nodeley at one end of Fraser Lake and Stalaco at the other end.
A client will come in wanting to see a doctor, or a client will come in to see the nurse and it'll be out of my scope and they need to see a doctor. So they'll do the vitals, I'll do the assessment, and then we'll come into the telehealth room and talk to Dr. John.
The fact is you haven't had a lot of these tests other than the echo, and they need to be done.
Yeah.
This telehealth project for First Nations communities was pioneered by Dr. John Polovich.
This has a way to take an antiquated system where, we funnel people into health centers, doctors' offices, and hospitals, and really bring care to where patients are and try to prevent them from having to go to acute care centers and hospitals and things like that.
Actually, it's nice. You can talk to your doctor. You don't have to travel or anywhere. You just show up here and it's really handy.
I think that the patients definitely have bought into the services that we're providing. They're definitely accessing the telehealth at rates that are impressive.
They love it, Patients love it, the healthcare providers love it.
A lot of people are really amazed at the technology that we have and that we can offer, and a lot of people have never seen something like this before.
Just basically you can come in anytime.
Instead of having to travel, say, to go see someone, they can just come into their own home community and just call someone up on telehealth, so it's great.
You don't have to, phone in to make an appointment. Oh, you can't see him until 2 or 3 days. Here you can just walk in, phone. Yeah, he's available. Basically see your doctor anytime.
Wes, don't stress. You'll be okay, my friend.
Alrighty.
I've always been a believer, and I knew this was going to work from the beginning, and it's just kind of continued to prove itself and remind me why it is successful.
In the end, we have a complete service from beginning to end, and if there needs to be any additional work done, it's done at the moment. There's no waiting for schedules or things to meet up.
Community health nurse Michelle Anderson works in several First Nations communities around Burns Lake, including Grassy Plains.
We really try to offer services that are reflective of the hours that people work and school hours, and trying to accommodate people on lunch breaks if they're working. Clients are able to have a visit with a doctor or a nurse practitioner and leave my office feeling like they received primary health care, which has been difficult to have access to in the north. Any pain in here?
On the right side.
Where, here?
Yeah.
When you're doing telehealth, it gives you that opportunity to have that one-on-one.
Of course, if something comes up.
The promise of this telehealth project is attracting more and more healthcare professionals, like Dr. Marie-Pierre Dallaire.
Oh, I think it's fantastic. I think it's improved our capacity to follow up with patients on a regular basis.
I'm just impressed with it. I think it's fantastic.
All the cost, all the time, all the childcare that's avoided, it's just great.
I think it's a very, very efficient and effective way of delivering healthcare.
Dr. Brian Skrinas realized the game-changing potential of telehealth for remote communities the first time he heard about it.
It's even a challenge in well-established communities where you have some resources to get people like physicians, like nurses, to come in and stay and live in these communities. And so I thought this was a brilliant way of providing these services to these communities in a sincere, compassionate, and caring way, but getting around the logistical problem of having a physician living in the community.
For other healthcare providers who do live in the community, telehealth has tremendous value.
Working as a community health nurse is really autonomous, so I'm here alone in the clinic, but telehealth allows me to not feel so isolated.
All the nurses, all the doctors, our nurse practitioner, we all connect over telehealth on our Monday morning meeting.
So I'm never alone, there's always support.
I love my job here, and I find that with telehealth, I'll be able to stay in my job for longer.
For patients, the big advantage of being connected is that they get top quality health care.
The services that we provide are oftentimes better than people even in urban centers like Prince George, because the physician and the specialist will actually be meeting at the same time with the patients and collaborating together.
A lot of the work, the bulk of the work, can be done without actually putting your hands on the patient. Not to say that that's not important, it is important.
In fact, face-to-face hands-on time with patients is an essential element of this telehealth service. It's a key to making it work.
At the root of this is connecting with people and building relationships. And then comes everything else. Being here establishes on-the-ground connections and relationships with people, whether it's the healthcare workers, the other staff in the health center, and the patients in the communities.
So for 1 week every month, Dr. John and the other physicians hit the road to visit their telehealth communities. On this day, Dr. John starts his rounds with a 1.5-hour drive from Fort St. James down a logging road to Yakuchi. He's got a young doctor and a physio team in tow and a full day ahead.
Telehealth is part of our healthcare delivery system. It's not the crucial element, it's simply another cog in the wheel of what we do. Just open your mouth up, say okay. Things like char and moose meat, right? Natural, the things that you traditionally have eaten are much better for you than...
I like macaroni.
Macaroni will definitely make your sugar go up.
Doctor days are busy. The clients, I feel, do appreciate having him physically here, being able to sit down face to face and have that encounter with him.
I think the two systems, whether they're virtual or face to face, are complementary. Do you think this has been a good thing for the community?
Yeah.
Even here in Yakuchi, he does telehealth calls from one remote community to another.
If you have anybody else you want me to see, let me know.
He's also helping the young doctor get some hands-on experience in remote health care.
That's what it is, clinically, okay? You don't need to do anything more about it.
And in keeping with the practice, the physiotherapist and graduating student provide physiotherapy both hands-on and over the telehealth network.
Can you come out to the side now?
For this side, it's like a pain going on top of my arm here.
After a full day in Yakuchi, it's back through Fort St. James to Takla Lake, 3 hours the other way down another logging road.
My hip is fine. I still get weather change sore.
Bit of swollen right around here.
Our people benefit from this telehealth.
So I'm really happy they have this machine here.
He brought up the picture on the screen and everything, showed me what muscles were sore and like this and that, what might have happened.
It took a while for us, but we came together and it worked, and I'm really happy that we have this in our community.
The community just embraces Dr. John.
They want to be involved in the care of themselves and their community, so that's the exciting part.